You will not believe what I just found in a published paper just done yesterday, looking at the benefits of a new drug, well, not a new drug, semaglutide, and protection from heart disease. How in the world did I get this connected to a question mark about vax risks in the heart? I'll have to show you in just a few minutes. So you better listen to this because this information is not available anywhere else. Now, let's be clear. This is my analysis. This is me looking at the data. It's not necessarily what the authors have published and what they want you to focus on, but it's certainly what I have been focused on and what I'm looking for when I prepare for what is this COVID storm. I am anticipating that things are going to get rough and that there's going to be a link to cardiovascular disease. So let's get straight into the questions and what it was that really happened. So you have to understand, and I've got this article here. So this article was just published just on the 30th of August 2024. Weight loss drug linked to fewer COVID deaths. And they were talking about this weight loss drug, Wegovy or semaglutide, which they found reduced risk from COVID by a third and reducing significantly the risk from cardiovascular disease or any other cause. And this was done by a Novo Nordisk. And critically, this is the important bit to note, is that from October 2018 through to March 2023, they studied the effect of giving it weekly versus placebo. And now you have to remember the trial started before COVID-19 and they never anticipated a global respiratory pandemic. So this is really valuable, clean data. What I mean by that is that it is not caught up in any narratives. It's just focused on clean data before the pandemic, not related to anything else. The question is, what did it show? And why am I talking about cardiovascular risk? Because they have talked about the fact that this drug seems to have reduced cardiovascular risk. So it's an important point for us to try and address. What really was it that they were looking at? So when we look at the paper itself, and you can see here again, this is published just recently. And you can see here that this is the paper here, the effect of semaglutide on mortality and COVID-related deaths, and an analysis from the SELECT trial. And again, you can see the date here, published August 30th, 2024. So this is hot off the press and a really important study for the drug because they want to promote it that it is able to protect against cardiovascular death. So they sought to assess the effects of this drug on cardiovascular deaths and non-cardiovascular deaths, including deaths from coronavirus. So this would have been added after the trial had started, because when they pulled it together, this was not yet available. They wouldn't have known about COVID-19 coming up. So let's just think about what it was that they were doing originally. And again, you have to think about their inclusion and exclusion criteria. And so I went and I got the clinical trials. This is what they have to publish in order to get their study on. And so this is the original analysis, clinicaltrials.gov. And they were looking at the time effects on heart disease and stroke in patients who were overweight or obese. That's the SELECT trial. And if you notice carefully, it was started here. This is the in 2018, the 24th of October, 2018. And it was completed here on the 29th of June, 2023. And what I usually am interested in here is who is eligible for it. And you can see here the eligibility criteria. Male or female, you must be at least 45 years old. Your BMI, your body mass index, must be equal or greater than 27 kilograms per meter squared. And critically, you have to have established cardiovascular disease. So this is not a normal population. This is a population who already has cardiovascular disease, prior heart attack, prior stroke. And as usual, they have a number of exclusion criteria. They look at people who haven't had it within 60 days. They look at the blood sugar, general history, safety stuff. So, all standard stuff that they would have done in order to get this study ongoing. So, as I said, this was started in 2018. And so, therefore, it was prior to the pandemic. So they were talking about the benefit that this drug has with regards to protecting against cardiovascular mortality. That's where it gets interesting because, again, my question is okay, it protects against cardiovascular mortality. Did you anticipate that? Was that what you were expecting? And my question is always in the back of my mind, how does this relate in terms of the pandemic, and especially the question about cardiovascular issues around COVID vaccinations? Because it seems as though there's lots of data out there that doesn't quite all add together. So, what really did this show? So, I'm going to highlight a few points here from the paper itself again. So, let's look back at the paper here. So, again, this is the analysis from the select trial. And their objectives, again, they were looking at on all-cause deaths, cardiovascular deaths, and non-COVID deaths. And they see here the most common cause of cardiovascular death with semaglutide versus placebo were sudden cardiac deaths and undetermined deaths. And so this is where they found that there was a significant benefit with regards to the participants who were using semaglutide. So, my question again is well, how did this play out in the context of the pandemic? And this is where now it gets very, very interesting. And when I looked at the data, and I have to say that I looked at it initially, just looking through objectively, just to see a picture, something stood out to me. And that's really what I jumped on. So I'll show you the not so worrying bits first, and then I'll show you the bits that I was really interested in. So here we have this is comparing semaglutide and placebo. And this one here is looking at COVID-19 deaths. This is C, event rates. And you can see they're going all the way from 2019 all the way to 2023. And you can see here, placebo seems to be higher than semaglutide. They come down together. Nice. It fits. It seems to fit. So there does seem to be some protection. And they have this bar here to represent the pandemic period, which they've picked up to early 2022. And that seems to make sense. It seems to be a scientific blindness that is occurring, and it has direct relevance to what's happening to people around us. We are at the point of needing to find solutions, finding mitigation strategies. And so, what we want is for us to look carefully at what is happening. And so, as usual, we always give you ways to support us. Remember, we also have our Kickstarter program, which is ongoing, and you can take a look at it here. Disease X, are you prepared? And we're trying to do a book taking on very many points that are relevant, because I think COVID is technically the disease X. I think that it is really where we're going to be challenged. So you can support us in that way. And additionally, if you want to support, we have membership on YouTube, we have Substack. You can look at the information. There's so many ways to support this research, and we appreciate it. And we appreciate the fact that our work to inform you is of value and something that's very important, because where else would you get independent, objective questions about what was happening? So, the main point is this: it does seem that there is evidence that this drug can help in terms of protecting, but is that evidence related to the fact that it stabilizes the cardiovascular system against damage from other sources of spike protein? That really is the question that I think needs to be answered. It may be inconvenient. It may not be what the scientific community wants to look at, but there is a responsibility to look at all the evidence, especially clean data, and to make a clear analysis. It's not difficult to break out that group. They have all the information on them. They could actually dissect it based on vaccination status and clarify that. That would be logical. Do a secondary study, give an answer, look carefully at it, make a clear review of what was happening. Let's hope that the scientific community does ask the hard questions, because otherwise, there are no opportunities for mitigation. Have a great evening.